Motlalepula Matsabisa believes traditional medicine should receive the same support and research attention as other medicines. Professor Matsabisa is the chairperson of the World Health Organization's Regional Expert Advisory Committee on Traditional Medicines for COVID-19, also Director of Pharmacology at the University of the Free State, and he joins me now. Professor, thank you so much for joining us. You're part of the World Health Organization. Is there growing global respect and interest in the power of traditional medicines?
Thank you so much, and I really appreciate, for being, on the channel with you. There is an increase, resurgence in the interest and the use of traditional medicines, and the reasons are many. But we are seeing the world moving towards, sort of natural products, interventions. We are seeing the world, whether it is in animal research, antibiotics, people are now saying, let's move towards natural products. So people and patients are beginning to take their own, decisions and choices on their health care. And they believe that, these options should also include, natural products. So indeed, there is a great interest in the use of natural products, whether these are for beauty products or whether these are for medicines, but indeed the interest is there.
Do we as yet have any proven effective treatments within African traditional medicine for COVID-19, or have we simply not got enough money to do the research properly?
There are lots of leads, of basic research that has been done, to look at, medicinal plants, against, the SARS-CoV viruses. But the challenge that I think, traditional medicines research has is really in the, funding. There is not enough funding, for traditional medicines. I always use the anecdote, where people say, don't put your eggs in one basket. We have put all our resources trying to find, a vaccine, for COVID-19, and totally ignored, the other, possible interventions. The human body and the diseases are not a one solution, where you could find one, cure for everything. We also understand, I'm not saying people should not take vaccines. Vaccines have got a role to play. I support, people being vaccinated, but vaccines, are not preventative. It does not mean when you are vaccinated, you may not contract COVID. You will still contract COVID, and you may actually contract the disease, but the severity of that disease, will not be, that great. Secondly, whether you are vaccinated, you'd still be a carrier, and you will still, transmit and infect other people. So we're now literally saying, let us look for also other alternatives in terms of natural products, in terms of pharmaceuticals. But there's a big sort of challenge, of equity in funding for research. Equity even in this country, where there is biasness, towards, funding traditional medicines. While, in fact, we know that in the past, whether we have gone back as far as the 1889s, looking at the Spanish flu, looking at the Australian flu, looking at the Russian pandemics, there were no vaccines at the time. People relied on natural products, and we keep saying those plants that were used for the Spanish, flu, they could actually still be relevant now. So we're saying we need to see equity, in terms of research funding, where equal chance is being given to traditional medicines for it to be developed, for it to get a special, not a special, an equal opportunity for research. Many of the epidemics that we had, for instance, you look at HIV and AIDS, we did the same mistake. We invested so much research on the HIV and AIDS vaccine. We never got a vaccine. We came up with AZT. AZT is actually a natural product. Many people don't know that. A lot of, for the, Asian, flu, the H1N1, the, product that came out there was from the Star Chinese, which was, a spice, a Chinese food spice.
Star anise, yes.
That brought up a drug called, Tamiflu.
Yeah.
And that Tamiflu is being marketed by Roche. And we're now saying, even in Africa, even here at home, give traditional medicines an equal opportunity for research, before we could outrightly, reject it.
You make so many important points. One of the things in the article that you've written that I've read, you suggest there's massive untapped resources. Only 20% of the world's plants have been researched, making your point, of course, that we need to put a lot more money into this type of research. And I really like what you say, that one can be in favour of traditional medicine, but also in favour of vaccines. We're seeing an alarming polarisation where people are frightened of vaccines and yet you're saying one shouldn't be frightened of vaccines, and at the same time we can explore more traditional methods. What do you say to people who feel that vaccines are wrong and frightening and only want to look at, say, traditional medicine?
I mean, we grew up being vaccinated, you know, as a child. When a child gets born, you get a BCG vaccine, you know, to help you, I think, prevent your TB and other diseases. But it does not mean that you are not going to get TB. It literally means that the severity of the disease is going to be diminished. Similarly, with vaccines, I've just said vaccines are not curative. You'll still get, I think, you know, infection. You know, you need to look at other pharmaceutical interventions, but at least the severity of the vaccine, of the COVID will not be that bad. It may not actually kill you. And therefore, but also looking at the different phases, I think, of COVID, you know, you have phase 1 where your antivirals might work, your vaccines might work. But in terms of phase 2, the virus actually is no longer there. The body has got rid of it. Then you got your own immune system fighting and producing these cytokines that go into, you know, a berserk mode. You call that a cytokine storm. And your vaccines will not work at that stage. Your antivirals will not work. What then works is you'll find that doctors use antioxidants. They use immune modulators. Where do these come from? You know, they come from natural products. And therefore, your natural products treatments could actually help you from phase 1 up to, I think, your post-COVID, where people, in fact, we are not doing very much in terms of the, you know, pharmacovigilance of post-COVID. Those people that had COVID and are suffering silently, you know, and traditional medicines could actually work there. Hence, my plea would be give traditional medicines an equal opportunity for research. We are not saying bring in traditional medicines, you know, indiscriminately. We're actually asking give it a chance to be researched. And we may actually surprisingly find interesting, I think, interventions and cures that may actually eradicate your COVID.
Yeah,
people must still go and vaccinate. People must still, I think, do your non-physical, I think, you know, interventions, you know, mask, short distances and all that. But none of these alone will, in fact, help us against COVID. You need an armament, you know, of interventions to fight the pandemic.
Such an important message. Thank you so much for your time this evening. It is much appreciated. Professor Motlalepula Matsabisa, Chairperson of the World Health Organization's Regional Expert Advisory Committee on Traditional Medicines for COVID-19, also Director of Pharmacology at the University of the Free State, making such an important point. Vaccines are crucial and must be supported, but we need to look at traditional medicines and role that they might be able to help us with in terms of treating COVID-19.